It's really interesting that cats are so often prescribed medications for behaviors. One of the most important things to think about when you're treating a cat with any behavior problem is that you need to try to get a diagnosis or a reason for the behavior. Because it's very often the case that some behavior problems are actually treatable without any drugs at all. And on the other hand, sometimes behavior drugs will actually cause side effects that are undesirable or even worse than the problem itself. So there's many drugs that are out for dogs and cats, and there's really very few that are approved at all in dogs, and there's none that are specifically approved for use in cats. So we always are choosing our drugs very carefully, considering side effects, and making sure we have a very accurate diagnosis so we can say this is the reason that we're prescribing, a good rationale for it. You might want to even think about getting an informed consent from a client and saying, you know, this is an extra label use, we've considered this carefully, and here's why we think that any potential benefit well outweighs any potential risk. Always go over side effects that can happen, which for behavioral drugs can always mean increased anxiety, increased aggression, loss of appetite, which we know is particularly a problem in cats. We certainly don't want to affect their appetite. One of the terrible side effects of behavioral drugs in cats is that sometimes if they make them particularly active, it keeps people up at night, so we have to be extra careful about that as well. So there's great responses in the patients that really need those medications. It's so great that we have those options, but we have to choose wisely.